Hello, my name is Dr. Darshawn Reed. I am an assistant professor of psychology at the University of Central Arkansas. I also serve as the student committee chair of the Arkansas Association of Black Psychology Professionals. And this talk is entitled The Psychology of COVID-19 Behavior and Decisions, and I will be talking about recent findings from psychological research concerning the COVID-19 pandemic. So during this presentation, I would like to provide perspective on COVID-19 and how it has impacted our day-to-day lives. I would also like to discuss some social and behavioral science research that can help us all understand our own behaviors as well as other people's behaviors, decisions, and judgments surrounding COVID-19 and vaccinations. And lastly, I would like to end with additional resources for you that you can review to help you make better decisions and take precautions against the COVID-19 virus. So, what do we know about COVID-19 and its impact on daily living? First, we know that the American Psychological Association conducted a study. It was called Stress in America, and it was conducted in January of 2021. And the results of this study suggested that more than 80% of the survey responders listed that the top source of stress was COVID-19. So we know this is impacting a lot of people, and you can see on the figure that most common emotion was anxious and or anxiety surrounding the COVID-19 pandemic. We also know that recent research has suggested that there's correlations between higher Google searches for worry and clinically relevant anxiety symptoms and COVID-19. So people are searching about information connected to their emotions and how they're feeling because of what we're dealing with. And that's not to say that this is a direct connection that the COVID-19 is causing these higher searches, but we do know that where correlation exists, there is something there that should be investigated. And we do know that a lot of people are dealing with extreme issues surrounding COVID-19. So it's impacting our day-to-day living, and we want to understand it better. So, social and psychological research has been conducted and has been being conducted since March when we first understood that this was a pandemic and that it was going to be a long-term situation. Some of the topics that have been discussed and or researched are included on this slide. A few of the things that I'm going to try to highlight and mention here is threat perception, so just how people are perceiving their risk, and then also understanding how our culture, the communication that is being used to promote the vaccinations, how that's impacting people and how their responses may be dictating their behavior. So let's go ahead and get into some of this research. The first thing that I would like to highlight is that misinformation is a big issue in the fight against COVID-19. So we know from recent studies that 30% of U.S. adults believe that Chinese government created the coronavirus and is using it or trying to use it as a bioweapon. Now, clearly, these are things that are being shared on social media. There's information that's just being promoted that is usually not based in fact. And so just being able to understand how misinformation is causing more harm, more anxiety for people, that is something that we are looking at in the area of social sciences. Another study conducted by Swartz, he wanted to identify the 5 criteria that people were using to decide whether information was true. The first one was compatibility with other known information. So what information did people already have about COVID-19 and how compatible was the new information with what they already knew? The second was the credibility of the source. Different people consider different people credible sources. So, for example, I may be of a particular political party and I may consider one person in my political party a credible source, whereas people who are not a part of my political party are not considering that person a source. So, what we are understanding is more about that and how that's impacting people's information that they're getting. And then the third one is whether other people's believe it or not. So, do the people around us believe the same information? Because that has a huge impact on whether we will believe that information or not. For example, if my family believes something, I may be more likely to believe it. Again, there's different variables, different factors, but these are the things that this research has identified that people are using or considering in their decisions. And then the next is whether the information is internally consistent. So, is it consistent again with how we believe, how we feel and value? Is that consistent with how we feel and believe? And then the last one is whether there is supporting evidence. Now, I do want to say that supporting evidence would possibly be, for example, you've heard that the vaccination causes some type of extreme side effect. And then supporting evidence could be you know someone personally that actually experienced that severe side effect. So, are we getting consistent information with what we're gathering? And so all of these things have been used to decide whether the information is true or not. And this was taken from the Handbook of Personality and Social Psychology. Some of these criteria are matched with what we understand from psychological principles that we've already studied before the pandemic. So, what this study actually shows and suggests is that people are more likely to accept misinformation as fact if it's easy to hear or read. And so, one of the things that I see that has been consistent throughout this pandemic is that when we are close to people, our significant others, our family members, and what they're sharing on social media, that may be more likely accepted and believed as true because of the source and who we're getting it from. So we have to check ourselves at all of those different post and whatever we're reading. We have to do some additional research on our own. We can't just take things for face value, and we have to make sure that that information is consistent and it's actually founded in facts and or evidence. The next set of studies also suggest that misperceptions of risk can influence COVID-19 behaviors and decisions. And I thought this was very telling because sometimes people may have an optimistic bias or optimism bias that they believe that bad things are less likely to happen to them and it may happen more to other people. So even though that optimism can be useful for avoiding negative emotions, it actually can be problematic because it would lead people to underestimate their likelihood of contracting the disease and also ignore the public warnings and precautions such as wearing a face mask, as well as also going to get tested and washing your hands on a consistent sequence throughout the day. So that's just one thing that we are understanding from psychological research, that people are harboring this optimism bias. Another thing that has been shown in a recent study by Tiber is that the people thought that someone who was close to them, which was an acquaintance or an enemy, when they thought about those three different people, they were asked to rate how much they wanted to avoid germs left by that person. And they used the example of actually touching or avoiding touching a tissue that was used to blow their nose. What they found is that people were more likely to say they would avoid the germs when the person was an enemy than when they thought that person was close to them, such as a family member or an acquaintance. So we can see that people possibly are actually less worried about germs when they're around their friends and family and social people rather than when they're around strangers. So this could tell us that people are taking more of a risk when they're around family members. And we see that. I think sometimes people feel uncomfortable or awkward when they're around family in terms of wearing their mask or social distancing. But we have to be careful and we have to understand that the same risks are there if it's a family member or if it's someone we don't know. So we have to take that in consideration. And then people often conflate friendliness and trust as risk reducers, but trustworthy people can still contract and spread the disease. I know I read an article recently about a doctor that felt awkward about going to a party with other doctors because the other doctors were not actually wearing masks. And he felt conflicted because he knew the severity of the issue, he knew what they should be doing, but he was trying to decide if he was going to actually wear his mask. He did, but this is what type of positions people are being put in, and they're trying to reconcile how they feel because they're around people they think are friends or acquaintances or family members, and they're thinking those people are trustworthy so that they don't have to abide by those precautions. And again, we have to make informed decisions for our health. Other research can talk about how groupthink, which is a concept in psychology, can affect COVID-19 decisions and behaviors. So people in group often make mistakes, not because they have been overcome by their emotions or have subpar intelligence, but it's because the group level processes prevent them from accurately appraising or understanding the information. So they are less likely to identify errors and or consider alternatives. So rather than assume individuals who resist health initiatives misunderstand health threat or are too stupid to understand it, a groupthink theory or analysis would track their noncompliance to the group level process rather than the individual one. So sometimes it's just by being a part of a group that we're actually making those types of decisions that could be harmful to our health and behavior. And the media of accounts of this non-compliant group suggests that conditions often cause groupthink, such as high levels of cohesion and isolation, stress among conformity pressures and directives, but misinformed leadership. All of these things have been talked about in the media, and they would suggest that we are seeing this groupthink happen in real time as it relates to COVID-19. And then further research has investigated how religiosity can actually impact choices and behaviors. And we do know that people of color are more likely to be religious or spiritual. And so we do have to understand how that may be impacting people's behaviors and decisions. And so in this study in 2020, they used a shelter-in-place directive as an intervention in a quasi-experiment. All this means is that they studied the people who had shelter-in-place policies in their states or in their regions, and they used that to measure how much people were likely to adhere to those policies, such as social distancing, wearing face masks, hand washing, all of those things that we know are helping to mitigate the spread. So what they found was that when a shelter-in-place directive had not been imposed, religiosity did not affect people's movements. However, when the directive was imposed, higher religiosity resulted in less adherence to shelter-in-place. So the more people were religious, spiritual, whatever you want to term that, they were less likely to adhere to those specific guidelines or policies to mitigate the spread. So we do know that there's a connection. Again, that's not to say that this is a causal statement, but this is saying there is a relationship between religiosity and people's choices to be able to take those precautions. Now, when we talk about vaccine hesitancy, there is information that we can pull from. This is just information that I pulled from the Kaiser Family Foundation poll that was conducted in 2020. And so they found that 27% of the responders said they would not be vaccinated. And you can see the breakdown of those 27% over to the left. And then on the right, you can see the common themes that were found among those who said they were not going to be vaccinated. And the top was the worry about possible side effects. And the second highest was the distrust in government to make sure those vaccines were safe and effective. So, research focused on understanding vaccine hesitancy, communication, and behaviors suggests that there is mistrust of the medical community among Black Americans, and it is rooted in historical events such as the Tuskegee syphilis study, which a lot of people know about, and how that led to the mistrust of treatment and healthcare. And so we have to consider these particular things when we understand why people may not want to get the vaccine. And then some other information that we have to consider is also going to be specifically about the communication and how we can open up the communication to mitigate this mistrust. So there is some promise in hopefully energizing some of those professional organizations, such as the Arkansas Association of Black Psychology Professionals. We are interested and invested in helping communicate information to our population and our community of interest. And so this is one of the ways that we can try to help understand, but also help people get past some of that mistrust. And so if we are exerting ourselves and putting ourselves in a position to communicate with the community, that will help hopefully overcome some of the mistrust that we see. And then you also have to consider some people are actually fearful of getting shots or needles. And so that is a small population. So some people are choosing not to get the vaccine because it has more to do with being afraid and or fearful of needle injections. And so that has been documented in research as well. And so you have to deal with some even phobias that are surrounding the behavior that we see with COVID-19. In terms of communication, some of the information from the National Institutes of Health has suggested that we use evidence-based strategies that are tailoring messages and framing the vaccine in a apolitical decision, as well as talking about the benefits of getting the vaccine. And hopefully that will help some people understand and overcome the misinformation, and also not politicize the decision in that for that way as well. And then other research has talked about how positive emotional messages that include altruism or helping as well as hope are more beneficial and effective than negative framing and or negative messages. So talking to people from a punitive standpoint or from a guilt or shame standpoint is not effective, and we have to communicate this information using hope and altruism and talk about how we can help people and how we can help each other, how we can help our communities. So that is very important. And then also including in our communications the idea of psychological reactance. We know that people who are afraid of losing personal freedoms and or personal rights, they are going to want to react in a way to protect those rights and to protect that freedom. So some people are very strong advocates for personal choices and personal freedoms. And that's not to say that we want to communicate that this is not a personal choice. It is a personal choice. So we have to understand how we're communicating may actually be off-putting and or influencing people in a negative way, in terms of how they're responding, how they're deciding, and how they're acting in terms of the COVID-19 virus. So in terms of the behavior, a few things to consider is first, we have to understand that the intention to get vaccinated might not outweigh the accessibility or logistics. So we know that it takes a lot just to try to get an appointment to get the vaccine. We know that it may be 2 different appointments that we have to get now for the vaccine. So people have to take time off of work. People may have to actually get transportation to and from the location of their appointment. We know that research has shown that sending text message reminders of those appointments have been helpful, and in some cases have increased the responses and the return visits by 10%. So we can see that there are things that can help that would increase the behavior or the outcomes that we're looking for in terms of getting people vaccinated, as well as just communicating and getting people to respond to those precautionary but things that they should do, such as social distancing, wearing a mask, and also washing hands on a regular basis. So other research we have looked at has suggested that paying people to go get the vaccine is probably not a good idea, because one, it could communicate that this is a strong risk, and if you are not getting paid, you should not take this risk. And we don't want to make people feel like that they are putting themselves in danger or in harm's way, because the vaccine is safe and it is helpful, it's effective. There are some risks to getting the vaccine, but those risks are small or minimal compared to the outcomes that we may see if they are contracting the virus and have a very severe case of the virus. So we want to make sure how we're communicating doesn't communicate something we don't want it to. So paying people has not been shown to be effective or helpful in this particular cause. And then some people are actually excited. We see in their behavior, they're sharing pictures. You have to be safe about sharing pictures of your COVID vaccine card online, because that's a easy way for people to target you and get your identity and steal your identity. So some people are overjoyed. They're excited, and rightfully so. They may feel like that they have their freedom back. They may feel like they're more able to go about their daily living without any impediments or any barriers. Other people are very scared and or guilty or shameful because they may have gotten the vaccine before a family member, or they may live in a state where the vaccine is prioritized differently. So we see even differences in after people have made a choice, how that can impact them and how that can impact their feelings and their behaviors. So we're doing more research to understand the complex issues that surround the COVID-19 virus, but we wanted to share this information with you all so that you can understand that we can make our own personal choices, but we also have to understand that there's other reasons behind why someone may choose or may not choose to get the vaccine, and or may not be abiding by those CDC guidelines that we see posted everywhere. So this information is shared to help us better understand what's happening around us right now. It's not in any way meant to tell you what you should do, because we want you to make the best decision for you. We want you to make the most informed decision for you, but we definitely all need to be aware of how our behavior, how our thinking, and how our judgment is being impacted right now. So what information do you need to make an informed decision about your health? The last part of this presentation is just sharing that information. You can go to the Centers for Disease Control to get the most up-to-date and accurate information about where we are in the process of vaccinations and what new vaccines may be coming online. You can also go to the Arkansas Department of Health to understand more about what the state of Arkansas is doing to mitigate the spread, and also to get information about where you may be able to get your vaccine if you choose to do so. And then you also have information you can get from UAMS, the Center for Health Literacy. They have put out a huge, I think, program or initiative to try to make sure that we're communicating the right information to the public and to the community. And so, what I want to share right here is a link to the Arkansas Immunization Action Coalition, which COVID-19 community booklet. It has information that is very evidence-based, and it's sharing just information that anyone can pick up and read, and it would not include major terms or information that you would not be able to consume. It's very user-friendly, so I wanted to share that as well. And I hope this presentation at least enlightens us more about how COVID-19 is impacting not only what we see on the outside, which is people's behavior, but what we don't see, which is on the inside, which is their thinking as well as their feelings and their emotions. So thank you for listening, and I hope that you are taking those precautions and being safe, because we all need to work together and we want to make sure that we have a better future and a better outlook. So thank you, and I hope you enjoyed this presentation.